Welcome back to Less Than 3%, where we talk about my journey to become a physician, healthcare, medicine, or really anything else from the perspective of a black man pursuing medicine. And in this episode, back on the podcast, I want to talk about something that is quite heavily contested in terms of a lot of different topics that have to do with healthcare, medicine, and just a healthcare system altogether. And so for this episode, we're going to get into something known as universal healthcare. So there's a couple questions that I want to answer about this. And this is something that I expect to probably do a couple of episodes on, because I think there are quite a few things that I'm thinking through when it comes to this topic. So first of all, what is universal healthcare? Why is it so contested? And what are some pros and cons? What are the implications of universal healthcare? And lastly, I think it matters. What do I think? So let's get into it. So first thing I want to do is just define what is universal healthcare? What is universal health coverage? What does that have to do with health? What is the importance of that? So the World Health Organization, WHO, they define universal health coverage as meaning that all people have access to a full range of quality health services that they need, when and where they need them, without financial hardship. It covers the full continuum of essential health services, from health promotion to prevention, treatment, rehabilitation, and palliative care, etc., etc. In addition to this, it's important to note that this often plays into a very specific system of healthcare that has actually taken place in quite a number of countries, which technically does not include ours in the United States, but there are a couple I'd want to name off. So for instance, I do want to take a look at an article from the Commonwealth Fund, which kind of went into explaining some of these different countries that have this sort of universal healthcare system and why I think it could be important to note this. So first, they mentioned Australia. Even another important thing to note is probably that it took a number of years of political tension to get to a place of a universal public health insurance program, which is known as Australia's form of Medicare. To name off a couple more, you have Brazil with its Brazilian healthcare system that's been around from the 1980s. You have Canada, which is a very, very popular example of universal healthcare, as right above us, they have a very official universal publicly funded healthcare system. China, Denmark, England, France, Germany, and a couple of more countries as well, just to name a few. So one of the reasons this gets talked about so much is because this is something that we actually find in quite a number of countries that we're familiar with in terms of how they set up their healthcare system, but it's also not something that we particularly do as a country ourselves. And so I think one thing I'd probably want to journey a little bit more into would really be some of the real differences between our US healthcare system and some of the systems of these other countries. And that's probably something I'll get into in another episode. So pretty much one of the main reasons I'm bringing up this topic and we're getting into this in the podcast is definitely because this is something that I'm learning more about and wanting to get into myself. So I figured it would be interesting if, as I'm kind of looking into this topic, learning a little bit more, researching, I share some of my thought process and some of the pros and cons that can come with universal healthcare, and see maybe what some of my early conclusions would be. I actually have an article published on procon.org which talks about universal healthcare and some of the different pro and con arguments that can come with it. So I'm just going to name a couple of them. So for the first pro, the United States already has universal healthcare for some. The government should expand the system to protect everyone. One thing it goes on to mention in this pro is that if the government can successfully provide universal health care for 36 to almost 50% of the population, then the government can just provide universal health care for the rest of the population who are just as in need and deserve to lead healthy lives. And I definitely think they have a point in saying so. Now for the con it mentions on this point, universal health care for everyone in the United States promises only government inefficiency and healthcare that would ignore actual realities when it comes to the country, when it comes to the free. Now for the con, so it goes on to mention that some of the challenges of universal healthcare implementation are vastly different in the US than it would for other countries. And additionally, that a system like this in the United States would really just hinder medical innovation and entrepreneurship. The reason for this is that, as I mentioned, when you take into account both costs of coverage expansion and savings that would be achieved if you have a Medical for All Act, so really a universal single-payer healthcare system, it would lead to about a 13% savings in national healthcare expenditure, which would be quite significant savings. However, on the other side, it mentions that universal health care would raise costs for the federal government, and if that happens, that ultimately means more for taxpayers. It's also important to recognize when they mention this as well is that the cost of like a fully universal healthcare option wouldn't just be something that would increase and heap taxes on the wealthy, but taxes on the middle class would really have to rise in order to pay for something like that. And so those taxes, as I mentioned, would really be imposed directly on workers, and so that could potentially have some negative impacts as a result. Now, the last thing I want to mention from this article, which I honestly think would really be one of the most significant things to mention, would just be that universal healthcare would improve both individual and national health outcomes. Now, I would pretty much go on to say that this is probably one of the most fundamental aspects of healthcare, which is that you ultimately want to improve individual outcomes for patients, and also when it comes to on a national scale. Now, there is a drawback that gets mentioned, which I definitely think is important to consider as well, which is that if you have this sort of system, what that can also do in expanding a lot of health coverage, potentially increase wait times for basic care and make Americans' health overall worse in that way. This is actually something that I've noticed in the short amount of time that I've spent really going into this topic and starting to learn more about it, is that even in Canada, this is something that could potentially be this could also potentially be a sort of complaint that could come out of a universal healthcare system. So this is definitely something I want to look into a little bit more. Now, with that being said, there's a couple more things I want to add in terms of pros and cons, because I also found another article that I think was really, really helpful. So this is written by Kimberly Amadeo on a website known as thebalancemoney.com. And it also goes into some universal healthcare pros and cons and a couple other aspects that I think I want to touch on a little bit later. So getting into this article, just to really list off some of the pros, it mentions again that universal healthcare would lower overall healthcare costs, that it can lower administrative costs, that it can standardize service, that it can prevent future social costs, and that it can guide people to ultimately make healthier choices in the long run. Now, on the con side, it does mention that in this case, the healthy would pay for the sickest, there would possibly be less financial incentives to stay healthy, longer wait times for elective procedures, doctors incentivized to cut care to lower costs, healthcare costs overwhelming government budget, and the government potentially limiting services with lower probability of success. So just off of a lot of the pros and cons that I mentioned, I would say that there are definitely some things that I would agree with, and with some of the points that were mentioned, and probably some things that I would more so disagree with as well. Just to really name off a couple of different values that I think should play into this conversation, and probably some of my thoughts on it, at least as of right now, is definitely that healthcare, I would say, is a national right. So one thing I'd mention is that I think each and every human being has ultimately a right to life. And I would say that healthcare is ultimately there to really be a part of an extension to that right to life. So with that being said, I think we ultimately want to definitely pursue the things that can allow for as many people to receive the best quality healthcare as possible. Now, there are definitely some nuances that I think are to be seen in here with some of the pros and cons that I mentioned, because I think on both sides you could argue that there are some things that would help or maybe not help benefit the most people possible with really the best quality healthcare possible. I think, for instance, on the pro side, you can mention that universal healthcare, as probably one of its main initiatives, would for sure expand the amount of people that are able to have access to quality care. While at the same time, you could also argue that perhaps you wouldn't be able to provide the highest quality of care that you could to as many people, or maybe the quality of health would really lower too much to where it may be more harmful than beneficial. I think those are just some things to maybe throw out there and think about. Now, I think the last question would be, what do I think exactly? And in terms of what I think and what my verdict would be on this topic, I would say, I don't know. I think just off of reading a couple of things so far and getting used to maybe this topic in of itself, I don't think it would be enough for me to really just come down on a verdict and say what I think my take on a universal healthcare system altogether would be. So I think as we continue to go through some of this information, and I think I definitely want to do some more episodes on this topic, I think I'll probably, over time, really be able to formulate more of an opinion on this topic. I think one thing I've been learning to do has been to definitely explore some of the different nuances that come with different topics and not really rush myself to come to a conclusion on certain things. So for now, I would say I'm okay with saying I'm not sure. I would say There are definitely some things I want to learn more as to why some people would argue for and ultimately why some people would argue against an entire universalized healthcare system, especially in the United States specifically. As for other countries, there may be other reasons that different systems work. And that's something that hopefully we'll definitely get into on this pod. So I hope you enjoyed this episode, and let's see what we'll talk about in the next one.